Empirical observation is a term that you're going to come across throughout all of your study, and essentially what this means is that the Chinese have studied humans and our interaction with the environment for thousands of years. We study animals as well as human beings, and we observe when someone is behaving in a particular way, and we also observe the other events which may be happening at the same time. So examples of empirical observation would be a person presents for sneezing or insomnia or headache or painful periods. There would be other accompanying signs and symptoms, other accompanying associated events with those presentations. Our job is not just to treat the sneezing or the insomnia or the headaches. Our job may also be to treat the cause of those particular conditions. Traditional Chinese medicine, we're going to be studying different aspects of this very rich therapeutic tradition. Yin and Yang is a profound phenomenon. It's a central part of traditional Chinese medicine. More about that later on. We're also going to be looking at the vital substance called Qi. And there are other vital substances as well, such as blood and essence and body fluids as well. We're going to be looking at the 14 meridians in the body, as well as the points, the acupoints that form parts of these meridians. We're going to be looking at tongue and pulse taking as part of this course. We're going to be looking at the functions of the internal organs, the landscape that we work on. Learning traditional Chinese medicine, and this is advice that I give to all of my students, you can't learn it by rote. You can't learn it off by heart. You must understand this therapy from inside. You must understand the schema that traditional Chinese medicine is regarding life and health. It may be difficult at times. However, it is very simple, and sometimes here in the West we complicate our lives, we complicate different subjects that we study. However, my advice is for you to take it one small step at a time. We have 2 years before you're going to be examined on your diploma, 1 year before you're going to be examined on your certificate, and 1 year is a long time. So one step at a time is the advice. Learning traditional Chinese medicine, I suppose, is like completing a jigsaw puzzle without the clue picture. We get some information on the points, the location, the functions. We get information on yin and yang, and we learn how these interact with each other. We learn how the points interact with the 5 elements and the vital substances, and then we have the techniques. And when we put all of the different aspects of the course together, we eventually end up with that new therapy, new set of skills that we have called Tuina Chinese Medical Acupressure. I'm often asked regarding functions of the points, because when we look at the textbooks we see literally thousands of functions associated with points. I want you to understand that there are 3 basic functions initially. Later on we'll expand on these. The first function is that there are points that tonify. This is the same as nourish. You'll see other points that strengthen. So in other words, if we want to make something stronger, we would be stimulating particular points that tonify, that nourish, or make something stronger. In other words, we may have a patient who has a weakness, and we want to make that patient have more vitality, more strength. There are other points then as well that reduce or clear, eliminate, or dispel. And these are all the same meanings. So in other words, we have a patient that presents with a common cold, for instance, and we have a full-blown cold inside the patient. They're spitting up green phlegm. That's telling us that there's something extra in the body that we don't need, that we don't want. And when we have something in the body, we want to clear it. And there are points that clear this excess from the body as well. And then we have points that regulate. These usually are, so in other words, if we have a patient who's vomiting and also suffering from diarrhea, then we may want to use a point that regulates the intestines. Next, we're going to just discuss the practical session that we did in class, and the points that we pay particular emphasis on. And the first one is LI4, or large intestine 4. Sometimes it's written as CO4 or colon 4. Large intestine 4 is located midway between the junction of the first and second metatarsal bones and the margin of the web. And for today, although when we look at large intestine 4 it has many different functions, I would like you just to think about large intestine 4 as clearing pathogenic factors. So in other words, its job is to clear from the body. The next point that we're going to discuss GB20. And here you'll see on these diagrams that GB20 is located in the depression between the upper portion of muscle sternocleidomastoid and muscle trapezius at the same level as DO16. We also have another point from the last lesson, and it's GB21. And this, you can see from this diagram, is located midway between DO14 and the acromion at the highest point of the shoulders. If you're studying this particular video without having been in class, then the best of luck to you. You need to talk to some students to help you to locate these points and to be able to stimulate these points. I might add in here now as well that GB21 and large intestine 4 are both contraindicated in pregnancy. So going back to the slide on the functions of these points, you can gather that these 2 points clear from the body. So anything excess in the body, these 2 points will clear stagnation and excesses in the body. They're contraindicated in pregnancy, and this should be remembered throughout the entire course. The health boosting acupressure sequence that we study as part of this course uses a combination of rolling method, one finger pushing, grasping, kneading, vibration, pinching and plucking. And knowledge of these Tuina techniques is required to be able to perform this particular sequence or routine. During our session, we started off by nefa, or squeezing the legs from ankle to thigh. We moved on to rotation, rotation of the hip and traction forward, and then we went to squeeze the arm from the wrist to the shoulder, shaking the right and left arm to finish off that particular sequence before we sat behind the patient and conducted our neck stretch. And this is the position of a flat hand under the neck, where the center of the palm, or P8, was directly underneath DO16, with the patient lying on their back, and there was a gentle pull to tip the nose forward. We supported the neck with the right hand, waiting for the dural pulse for at least 2 minutes. After we got our dural pulse, we then went on to do our finger lift at the occiput, and this was for a minimum of 30 seconds. After that, we pulled the neck to the left, push the right shoulder with the right hand, support under the head with the opposite hand. And then we press on GB20, we knead along the neck with the finger pads, and then press on GB21. And then we repeat that for the left shoulder. So we start off on the right hand side. That concludes the video review of our first class. I hope you enjoyed the first lesson, and until the next time, Sláinte.